I will put this presentation into 3 separate presentations to make it easier to download and easier for you to view. There's about 90 slides, but it's almost all pictures of CAT scans. So don't get upset and don't freak out, because almost everything here is images rather than text. Please focus on your CT scan images rather than the MRI images. The CT scan images are of better quality, and I think the resolution on the scans is better. The recommended reading comes from Chapter 7 and Chapter 8 from the 4th edition of the Sectional Anatomy textbook. I'll also try to get to you the pre-made exam questions that come with the textbook, but I warn you, every once in a while students do find a miskey or a wrong answer in these items that I send out. I try to go through them, but every once in a while I might miss an item too, so I always appreciate it when you guys find one and send me the correct answer. I will occasionally use exam items directly from the pre-made questions that they ask in the book. One thing I do want to mention is that this is a presentation of CT of the abdomen pelvis. I'm not going to go into the reproductive system. Those items will be covered next year in your genitourinary course. We're only going to focus on the abdomen pelvis as it applies mostly to the GI system, the foregut, midgut, and hindgut. So your learning objectives are over here. You can double click on this and download it as a Word document. Slides marked with an asterisk have some optional content, and we'll go through those, and I'll make sure that we've pointed out what's important for you to know. I did make a note here that the hepatic veins don't focus on the specific divisions of the hepatic veins, but we will look at them, and I will go through them. It's not that I necessarily want you to ignore the hepatic veins. They're just not an absolute priority. And please do not memorize the hepatic segments. Again, we'll go through those. You need to know that these segments exist, what they are, and where they are, but you don't need to know that on rote recall instant memory. So let's look at the boundaries of the abdomen pelvis. And you've heard me say before, when you're ordering a CT scan of the abdomen, always ask for a CT scan of the pelvis with it. There are different codes. Hospitals charge differently. Radiologists have one billing to read a CT scan of the abdomen. They have another bill and another code to read CT scans of the pelvis. The abdominal cavity, of course, is defined here by where this arrow is, from the tip of the xiphoid process down towards the tip of the pubic symphysis. And this really here is the pelvis. The sacral promontory, of course, is located here. But in terms of needing to find pathology with your patient, this is the area you're going to look at for the abdominal cavity. This is the pelvic cavity. You've seen all this before. I did highlight the renal fascia, Gerota's fascia here. Some textbooks do show fascia directly adherent to the kidney itself, and they call that Gerota's fascia. This is different here in this textbook, and they call fascia of the perirenal fat versus the pararenal fat. What I do want to show you is the retroperitoneum that follows this area here and comes down like that. We'll see that more when we take a look at our scans. Let's look at the liver and its ligaments. So at the very top, just like a crown, and that's where the word coronary comes from, we have the coronary ligaments. And then on the outer aspects, the left side of the liver and the right apex, we have the left triangular ligament and the right triangular ligament. Here's the falciform ligament, which is adherent to the undersurface of the anterior abdominal wall. And in the most inferior aspect of the falciform ligament, we have the round ligament, also known as the ligamentum teres. And what does the word teres mean? Teres means round. So there's a round ligament of the uterus. That's different. Here we're talking about the round ligament, ligamentum teres, as it goes through the very inferior aspect of the falciform ligament. So on the back side of the liver, of course, we can see the bare area where there is no peritoneal covering, and subsequently there is no pain fibers here. We know the inferior vena cava splits the liver into a left and right side, left lobe, right lobe. And then, of course, we have the porta hepatis, which is made up of three anatomical structures: the hepatic artery, the portal vein, and the hepatic duct are together called porta hepatis, or the portal triad. Now, they've shown us the left triangular ligament here, and then they say the right triangular ligament goes way down here, but that's not really what it looks like on our previous slide, does it? Our right triangular ligament here, left triangular ligament there. And yet when we look at the posterior aspect of the liver, where the bare area of the liver is adherent to the undersurface of the diaphragm, we see the triangular ligament actually goes and extends much more inferior than does our left triangular ligament. So how can you remember the caudate lobe of the liver, which you will rarely, if ever, see? How do you know the caudate lobe is adjacent to the inferior vena cava? Because C is for cava and C is for caudate lobe. So looking at the posterior aspect, we have the coronary ligaments, which again mean apex, crown, the bare area, the right triangular ligament, the portal vein. Here's our gallbladder, the porta hepatis, the incoming area of those three structures into the liver proper. I don't really care about the impressions. To me, that's minutia. So let's just gently go through the abdominal viscera. We have the esophagus goes through the diaphragm through its own hiatus. We have the stomach, of course, the pancreas, the duodenum is here. The ligament of Treitz is located just about there, and that separates the duodenum into the proximal jejunum. We have our small bowel, which is consisted of jejunum, and then distally it's the ileum. We have an ileocecal valve here. Of course, the appendix at the cecum. This is called the cecum. It's the thinnest portion of the colon and most prone to explode if it gets bigger than 10 centimeters. And 10 centimeters is a magical number that you need to remember. Here's the tinea coli muscular band that goes across all of the colon. Sigmoid colon is here. Remember, the sigmoid colon has its own mesentery, so it is actually considered intraperitoneal. Ascending colon, descending colon are secondarily retroperitoneal. This is not clinically important. It is minutia. Transverse colon, the right lobe of the liver, left lobe of the liver, and here's the falciform ligament. And the round ligament or ligamentum teres would be right there. So let's take a look at the fissures in the liver. And this will make a lot more sense when we look at a CAT scan itself. But if we look through a section of the liver, we can see remnants of these embryological structures. We have our inferior vena cava. We have the fissure for the ligamentum venosum, which is a remnant of the ductus venosus. And then we have the fissure for ligamentum teres, which we have an interlobar fissure. That makes sense. And we have a transverse fissure. So transverse fissure, interlobar fissure, and the fissure for the ligamentum teres, which again, teres means round. So the round ligament of the falciform ligament, this is its fissure. And then the fissure of the ligamentum venosum, over here in portal circulation, it comes from the ductus venosus. So from the placenta, we have two umbilical arteries that go into the placenta, one umbilical vein that comes back. The umbilical vein, of course, is the one that carries the oxygenated blood. The umbilical arteries carry deoxygenated blood back to the placenta, and then from the placenta, it goes back out through this single umbilical vein, which carries oxygenated blood. So now let's find these on the CT scan. So again, we've got left lobe of the liver, we've got right lobe of the liver. Here's our aorta, and here is our inferior vena cava. We have a stomach filled with contrast. Here's our spleen. And then here is the fissure of the ligamentum venosum. Portal vein can be seen in those fissural cracks that we see there. And then the falciform ligament is located here. And it's the falciform ligament that separates the liver into a surgical left lobe and right lobe. But remember, it's the inferior vena cava that actually splits the liver into anatomic left and right sections. So our caudate lobe, of course, IVC and caudate is right next and adjacent to the inferior vena cava. So here's inferior vena cava with our caudate lobe. Again, most important things that we're looking for are the fissures here: ligamentum venosum fissure, portal vein, falciform ligament, and we'll get in more detail here in just a second. So our quadrate lobe is actually up here next to where the gallbladder is. So on this CT scan, a lot of this you're going to recognize already. We've got, of course, our kidneys. We have the inferior vena cava. We have the aorta. Little bit of the pancreas here. We have a superior mesenteric vein and artery. We have some stool here in the hepatic flexure of the colon. This is transverse flexure of the colon, transverse flexure of the colon. And we have contrast material all in the small intestine. Here's the descending colon right here. And we can tell where the transverse plane is, that we're cutting right through the center of the pancreas. So we do get to see some of the pancreas. And that little dot right there is the common bile duct. Believe it or not, that little thing right there pays a lot more bills for a lot of people than what you'd imagine. So we have the quadrate lobe of the liver is adjacent up here to the gallbladder. We have, of course, the right lobe, and we can't really see the left lobe because I can't see the falciform ligament here. So please don't memorize these segments, but they're based on the embryology and the anatomy. So the falciform ligament with its ligamentum teres, or the round ligament, separates into the left lobe and the right lobe of the liver. And the left lobe is made up of segments 2 and 3. And then we see deep down, there's a segment 1, 2, 3. We have a 4A and a 4B, 5, 6, 7, and 8. Looking at the liver, splitting it right down the center is the inferior vena cava. And then we know that the portal vein brings in 70% of the blood to the liver. And then the portal vein actually will split into a left portal vein and a right portal vein. And once all of this blood comes into the liver, it leaves the liver and joins the vena cava through 3 hepatic veins. We have a right hepatic vein, we have a middle hepatic vein, and we have a left hepatic vein. And we'll see those more clearly as we look at some more scans. So here's a coronal CT scan, and it's showing us the portal vein, which is made up of the superior mesenteric vein. I don't see a really good looking inferior mesenteric vein, but that might be it. I suspect this is splenic vein here. So we have our stomach. This is the body of the pancreas. And then they've labeled the segments of the liver. And please don't memorize these, but let's follow some of the vascular anatomy. So here's our portal vein, and it's splitting into a left portal vein and a right portal vein. Of course, here's a head of a pancreas. Superior mesenteric artery is right there. This is the artery. And superior mesenteric vein is here. So that portal vein is made up of a splenic vein, a superior mesenteric vein, and an inferior mesenteric vein. And I suspect that might be the inferior mesenteric vein. So let's take a look at these just real quick. And let's look at a better section, a caricature section of the abdomen. So once again, we have the aorta. Next to the aorta is the cava. And then we see the diaphragm here. And they're telling us that this is the median arcuate ligament of the diaphragm. Don't really care about that, but this is diaphragm here. Of course, this would be lung tissue back here. When we look at the inferior vena cava, we can see it's giving off the left hepatic vein, middle hepatic vein, right hepatic vein. And I don't care about the segments. Leave that to the liver surgeons. There are 8 segments, and we'll see each of those as we work through this presentation. Stomach and spleen, of course. So now let's go look at this on a real CAT scan image. So here is liver. Here is aorta. Inferior vena cava is right there. This is the esophagus, and you can see the esophagus has a little dot of air inside of it, right there. Of course, this is lung. This is thoracic cavity back here. This is lung. But most importantly, we can see the left hepatic vein, the middle hepatic vein, and the right hepatic vein coming down here. So you say, what is this one? Well, I don't know. It's a branch of one of those hepatic veins. Not that important. But what is important on this is you recognize the aorta, liver, and then you see cava. And coming off the cava is the left hepatic vein, middle hepatic vein, right hepatic vein. And notice where this section is taken. Way high up. Because it is these hepatic veins that drain the blood from the liver back into the systemic circulation of the inferior vena cava before it goes to the heart. So the flow of blood here is going to be this way, back into the cava. So it's flowing from in the liver down towards the cava, from the periphery of the liver down towards the central segment towards the cava. That's where our 3 hepatic veins are draining into the inferior vena cava. So we're way up high when we see this section. In this coronal section, we're really looking at the right hepatic vein. And we notice how the right hepatic vein is joining the inferior vena cava. This is probably inferior vena cava. This is probably aorta, where it's branching into the common iliac on the right side. Of course, we have the stomach, the spleen. And based on where this section is, we should be able to see the vena cava and not really the aorta. But that's not the case here. We can actually see cava and aorta. And I think this is probably kidney, although based on this section here, it's more likely to be small bowel. I can't tell for sure without the ability to scroll forwards and backwards. But really the important point of this coronal section is to show how the hepatic veins are joining and its flow is into the inferior vena cava. On this image, which is an MRI image, we're looking at the inferior vena cava and we're looking at those veins that drain into the vena cava. And those are going more peripherally here where the inferior vena cava is located. That, of course, is our middle hepatic vein, right hepatic vein, and likely this is the left hepatic vein. In this image, which is taken up pretty high, almost in the thorax, and we can see that there is a lot of lung tissue here in this image. The inferior vena cava is located here, and now we can see the right hepatic vein, the middle hepatic vein, and the left hepatic vein. Of course, we're up high enough to see the ventricles of the heart itself, and it's pointing out to us the different segments, segment 2, 3, 4, and then 7 and 8. But again, don't memorize these segments, but I would like you to recognize that we're up high enough here to see the inferior vena cava and those tributaries draining into the vena cava. In this caricature, we again see the inferior vena cava, the aorta. Here, of course, is our crus of the diaphragm coming around, the spleen, the stomach, tail of the pancreas, splenic flexure of colon. And now we're asked, can we tell the difference between branches of our portal vein versus branches of the hepatic vein? We may not be able to see that perfectly in these sections until we can get a good view either of the cava or of the portal vein. So here is the fissure of the ligamentum venosum. The caudate lobe is adjacent to the inferior vena cava. Here's aorta. This is stomach. All of this is stomach here. Spleen, of course. If this is cava, then we need to see whether these branches, which are more peripheral out here into the lung parenchyma, are actually draining towards the cava, in which case they would be hepatic veins, but they're more peripheral. So there's a good chance that these are branches of our portal vein, the portal system, and that's exactly what they are here. Again, in this caricature, we're looking at aorta, and then we are most likely at the celiac trunk, where it's branching into a left gastric and a common hepatic. Here's the inferior vena cava, and immediately adjacent to it, we see the portal vein. Of course, we have the different segments. Please don't memorize the segments. Stomach, And in our next image, we need to look to see if we can pick out portal vein and cava. So again, here is portal vein. Cava is right here. So these segments of vessels out in the periphery are most likely branches of the main portal vein. Cava, those branches we're going to see coming into the vena cava, the hepatic venous system, the hepatic veins, are going to be up even higher than this. So in this image, we need to recognize that this is inferior vena cava. This is probably just the bare tips of the kidneys coming in. We have portal vein. And then here we have falciform ligament. And then branches out distal in the parenchyma, which are branches of the portal vein. In this image, we immediately see the vena cava and the left renal vein draining into it. Here's the aorta. Here, of course, is right renal vein, duodenum, head of pancreas. And what structures run adjacent to the head of the pancreas? The large superior mesenteric vein and the artery, gallbladder, and then segments of liver. So without a doubt, a lot of this is repetition, but it's that repetition that you'll see that will help you learn to read these scans. So let's take a look with what is important here. And that is aorta. We have the crus of the diaphragm, kidney, adrenal, maybe tip of adrenal here, inferior vena cava, and immediately next to the inferior vena cava is the portal vein. Of course, we recognize falciform ligament and the regular lobes. So where exactly are we where the portal vein is immediately adjacent to that inferior vena cava? Of course, here's the pancreas. This is probably splenic vein here. If we look at where this section is taken, it's still pretty high up, but we do not see anything coming off of the aorta at this point. We don't see the superior mesenteric artery. We don't see anything related to the celiac trunk at this area. So we are at an area where the cava and the portal vein are immediately adjacent to one another. In the creation of the portal venous system, we're going to have the portal vein coming directly into the liver, and then the liver drains through our 3 hepatic veins here at the apex of the liver into the vena cava. So the flow of blood into the liver is via the portal vein and its branches, and then the flow of blood out is through the hepatic veins into the inferior vena cava. The portal vein is made up of course, the splenic vein, the return of blood flow from the large colon, and the return of blood flow from the right side of the colon and from the small intestine through the superior mesenteric vein. So you have inferior mesenteric vein, superior mesenteric vein, joining the splenic vein here at the confluence of what's called the portal vein system. Then we break it off into the right main portal vein, left main portal vein. So let's see what this looks like on scan. And I neglect to mention this, but what is a portal system? It's when a capillary bed pulls into another capillary bed through veins without first going through the heart. So we have capillary systems here of blood coming out of the spleen through one capillary system and then going into another capillary system here into the liver, leaving the liver and going back into the cava on its way to the heart. 2 separate capillary pools. Remember, you also have a portal system, the hypophyseal portal system up in your brain. So let's take a quick look at the inferior vena cava and see exactly what it is that I keep talking about. So we have the cava. You're very familiar with the right renal vein. The right renal vein and the left renal vein. And then, of course, we have the hepatic veins, of which there are 3 of them at the top. Phrenic veins, suprarenal veins, which, of course, this goes to the adrenal gland. We have a gonadal vein that comes off, and then we have our lumbar veins. But what's so important about this picture here? 3 hepatic veins coming from the liver, draining into the cava. We have our renal veins draining into the cava. And, of course, we're splitting down here into the common iliacs. So in the portal venous system, The portal vein is made up of the superior mesenteric vein, splenic vein, and this is probably inferior mesenteric vein, joining to form the portal vein. And once the portal vein gives most of its blood into the liver, remember the liver gets 70% of its blood flow from the portal vein. It branches into a left portal vein and a right portal vein. And these other tributaries that we see coming out up here, going into the inferior vena cava, these guys right here, those are going to be the hepatic veins. So branches off the portal vein, and then we have the liver draining itself into the vena cava through the hepatic veins up near the apex or the superior aspect of the liver. Vena cava, portal vein, and gallbladder, spleen, splenic vein, aorta, body of pancreas, colon, this is small intestine here, aorta, cava, portal vein, separated by a little parenchyma here of the caudate lobe of the liver. So where our splenic vein joins into the portal vein, we call it the confluence, the portal splenic confluence. Here's the aorta we see giving off a branch. This is probably the superior mesenteric artery here. Inferior vena cava, portal vein. This is stool from colon. This is also colon. And spleen, kidney, probably adrenal gland here. Here, definitely that little upside down V is going to be adrenal gland on the left. So an MRI of the portal vein. I mean, you can see how giant this vein is coming into the liver. And the liver now is draining itself back into the vena cava by these large hepatic veins. Of course, we have a gastric vein, left lobe of the liver. This would be falciform. Spleen, and a lot of colon. But the take-home message of this picture is the portal vein right here and these large hepatic veins draining back into the inferior vena cava. So CT scan of our portal system. Again, we have the main portal vein right here, and making it up is the superior mesenteric vein here, and spleen, colon, and liver. This right here looks like it's draining back up towards the cava, and it is, and that's a hepatic vein. Can't tell right there if it's right or left or middle. You can't tell just from this one section. Here we have our portal vein splitting into a right main portal vein. We'll see that a little bit better later on. I can't completely tell you where the inferior mesenteric vein is to make up the entire portal vein. And I can't see the splenic vein in this image. So this is, it's time for a break. Go ahead and load up part 2 after you've had a break. A lot of information here, and we'll keep going.